Okay, so it might be useful in this case to give the patients a little bit of background on what the gallbladder is and what does it do. So the gallbladder is mainly a reservoir. It collects the bile, which is produced by the liver, and bile is used to digest and absorb the food. So after we eat, there are signals that arrive to the gallbladder. The gallbladder wall contracts and push the bile through the bile pipes into the small bowel so it can meet the food, and the food can be further digested and absorbed by the bowel. So the most common reason why patient needs gallbladder surgery is because they have gallstones, and these gallstones are symptomatic, meaning that they cause problems to the patient. The symptoms of gallstone can vary from a simple biliary colic, meaning pain after fatty food or meals in general, sometimes associated with nausea, to more serious complications such as acute pancreatitis, which is the inflammation of the pancreas caused by the blockage by a gallstone of the pancreatic Jewish pipe, or acute cholecystitis, which is the inflammation of the gallbladder related to the fact that the stones, either multiple small stones or a larger one, block the outflow of the bile from the gallbladder. So these are usually the main reasons. There are also other reasons, more rare, that could require a patient to have its gallbladder removed. The operation to remove the gallbladder is usually performed with laparoscopy, so keyhole surgery, which implies to have 4 small cuts in the tummy. And the gallbladder is disconnected from the main bile duct and from its blood supply, and then it's dissected from the liver, and then it is retrieved through a special bag through the port, usually around the belly button, the umbilicus. And it's usually a day case, meaning that patient have the operation, they can go home the same day. It requires a general anesthetic, obviously, because it's keyhole surgery, but most of the time it can be performed with keyhole. Only when patients had multiple episodes of inflammation of the gallbladder and maybe there are problems during the operation. In very rare case, it's required an open operation, which is the old-fashioned way of removing the gallbladder, which implies a bigger cut in the tummy and a longer hospital stay. But nowadays, it's very, very rare. Not particularly. Obviously, the patient will have the pain around the small cuts. They might experience shoulder pains related to the keyhole surgery because some of the hair that is used in order to create space inside the tummy might remain trapped between the liver and the diaphragm, and it takes a couple of days to be reabsorbed by the body. If it's a more challenging than usual operation and there were a lot of scar tissue and inflammation around the gallbladder area, the patient might experience for a few days some pain in the right side, but it's a completely different pain from that one that we're experiencing before, and it's short-lasting. The pain that they will experience usually respond very well to pain relief medications that are given anyway to the patient at discharge. So usually takes a few weeks, between 4 and 8 weeks. As I explained earlier on, the gallbladder is only a reservoir. The bile is produced by the liver and it will continue to be produced by the liver. But instead of being stored in the gallbladder and pushed inside the small bowel only after meals, it will be constantly in smaller quantity be present in the small bowel. So we will still be able to absorb and digest food, but the constant presence of small amount of bile in the small bowel could trigger, especially at the beginning, while these 4 to 8 weeks passes, more frequent bowel movements or some looser stools, because that's what the bile is a little bit irritative to the bowel. But this happens only in a very few percentage of patients, and even if it happens, usually it lasts just for a few weeks. there is no consensus nor evidence that patients should avoid any type of food or drink after the operation. Usually we suggest to avoid fatty food, alcohol, and all these things that can trigger symptoms before the operation, so up to the point that the patient will get the operation. But after, there is no consensus. Personally, what I always suggest to my patient is to avoid for another week or so fatty food and alcohol, and then start reintroducing these things gradually, so that the body has a little bit more of time to get used to it.